Welcome to the Grassroots Army Podcast. This platform is for common sense people looking for up-to-date, accurate, and truthful information without the hot garbage corporate media bias. The power of one can lead to the power of many. You never know what small act that you may say or do that may literally change the lives of millions tomorrow. And don't you ever think that you can't make a difference, because you can. Good morning, my fellow Michiganders. Good morning, my fellow Americans. Welcome to the Grassroots Army Podcast. I'm, of course, your host, Garrett Soldano. And my goodness gracious, is the swamp kicking back. Obviously, this broke yesterday that the military-industrial complex is obviously kicking back against President Trump's pick for Defense Secretary Pete Hegseth. Now, breaking news is that President Trump is now considering Governor DeSantis for Defense Secretary, as Pete Hegseth has just been getting hammered by a lot of different people in a lot of different areas. Okay. And so this is where it's going to get frustrating for a lot of us. I absolutely love the pick for Defense Secretary Pete Hegseth. I think Pete's going to do a phenomenal job, but obviously the military-industrial complex is not going to like someone like Pete in cleaning house. So let's just reflect back on how good the Department of Defense and the Pentagon has been doing with financial audits, okay? So this just broke, I think a couple weeks ago, or actually no, just a couple days ago. The Department of Defense fails to obtain a clean audit again. After failing to comply with the CFO Act every year for 33 years, pressure is on the military to show where the money went, okay? They continue to fail the audit. And here's one thing that Rep. Nancy Mace has said, that nobody is ever held accountable, as the Pentagon fails the 7th audit in a row. In a row. Haha, I'm back. So we the people are getting sick and tired of this happening, okay? We finally get some good representation in there. And what happens is the rhinos of the world, and I hate that word, I really do, but I think it goes deeper than that. It's just the swamp. These people that are in bed with these swamp creatures in Lansing, they are going to kick back. And we knew this was going to happen. This is what happened during the first Trump administration. Is President Trump surrounded himself with not the right people, and it hurt him. Okay, but he's learned a lot, so it's going to be interesting how these changes kind of evolve. But it is frustrating for all of us, because the people have spoken. The people want change. The people want people like Pete Hegseth, Vivek Ramaswamy, Elon Musk, and all the other cabinet picks to go in there, because obviously what we're doing is not working, and people want change. And a lot of people are now awakened. Like before the pandemic, especially, people would just vote and they'd go on with their merry lives. But a lot of people have awakened now to all the corruption, to all the swamp creatures. And now the majority of Americans are like, hey, wait, we're done with this. We're done with sending billions upon billions upon billions of dollars overseas and not supporting the people here in America, right? So it's going to be interesting how this plays out, but it is frustrating. I feel the frustration. I'm frustrated. I think Pete will do a phenomenal job, and I'm hoping that he stays in there. But Governor DeSantis, let's reflect back. Okay, so I liked how Governor DeSantis is running the state of Florida right now. I like how Governor DeSantis has evolved his stance on COVID, where, if you guys remember, he was pretty much the first governor to take a stand, and he took a lot of heat for it. And he stood tall, and he recognized his mistakes. And to me, that's a sign of a good leader. Say, hey, we're going to adapt, we're going to improvise, we're going to overcome, we're going to do the best that we can with the data and the research that we have at hand. And he changed his tune a couple months in and says, we're not locking down. And I think he did, along with Governor Noem and some other people, did the right choices for us. And the research now shows that they did. That lockdowns did garbage, mandates are garbage, and everything else, everything we should stand for. Even the COVID after action report has stated that they didn't follow the science. Fauci should be thrown in prison, in my humble opinion. You guys all know how I feel about him. But here's my concern with Governor DeSantis is like, was he infiltrated? Right? So I just don't know. It's way above my pay grade. So like a lot of you that are watching right now, we're just going to have to sit back and analyze, but it is our job to hold people accountable. It is our job to call out things that we see and demand answers. And it's the elected officials' jobs, even President Trump's job, is to, let us know why, right? Why are we making this decision? We put you in the office. We're going to hold you accountable just like everyone else. And, if you don't like Pete, that's fine. But why is it? And let's move forward. But we need transparency now more than ever. And hey, the industrial military complex has been proven time and time again over the last 33 years, failing audits. It's not good. Where's our money going? All right. And they'll come out and say it's national security. They'll use that kind of blanket excuse for it. And I think we, the people, are just fed up with it. So I'll be watching today. I'll try to keep you guys up to date on what's going on. But I'm hoping that Pete stays in there, and we'll see what happens. That's for sure. Because I met Pete. Pete's a good guy, and I'm wishing him to be the guy in charge, because obviously it needs to change in our military, in the spending and everything else. Okay, I'm going to move on now to something I'm very excited about. Facebook, it appears, not garbage YouTube, not commie TikTok. But Facebook, as it appears, is allowing a little bit more information to get out on the platforms, especially things that we couldn't talk about before. If you mentioned mask mandates, if you were against the lockdowns, if you mentioned the COVID vaccine, you were deplatformed immediately for spreading misinformation, right? For endangering the public. I've experienced that over 10 times on that platform. But now I tested it the other day with some posts, and they're starting to allow a little bit more conversation. You know me, I'm willing to push the limit. We're going to see how much they do enjoy Garrett talking about this stuff, because I am extremely excited to bring a fellow chiropractic warrior, Dr. Ben Tapper, on this Friday at 12:30 Eastern Standard Time, where he's going to come on and we're going to talk about big pharma. We're going to talk about chiropractic philosophy, which obviously I'm very passionate about. We're going to talk about vaccines, the lockdowns, and he was one of the other people that were standing up ever since the beginning. Now, I have to give a shout out to my chiropractors who did just that. There are a lot of you out there who did. You guys don't get enough attention. I'm going to start bringing some attention your way, because you deserve it, because you took the hits, you took the hate, just like I did. But Dr. Ben Tapper was one of the chiropractors who stood up. Dr. Mike Hannafin in Alaska at the time, I'm going to show one of his videos of him standing up. Of course, I stood up. Dr. Semlo, a lot of people haven't known about Dr. Semlo out of Grand Haven, Michigan, who stood up against the mask mandates, and he actually even had a lawsuit that was dropped against the state of Michigan for those things. The state of Michigan dropped it, but he stood up. See, folks, you have some good chiropractic doctors, some chiropractors, as I like to call them, who are deep in philosophy, who stood up, was trying to do what's right, was against the lockdowns, was against the mandates. We believe in this thing called nutrition, getting the chemicals out of our food. We are all excited about making America healthy again. Chiropractors, you have a choice right now. You have a choice. As a profession, and this is a call out to all my chiropractors right now, you have a choice to fill a much needed void in the healthcare industry. You just have to explain to the patients what we have to offer. My goodness gracious, we have an opportunity for the first time in the history of our profession to really come out there and speak about the things that we have been very passionate about ever since we were founded back in 1895, about the 3 T's, about thoughts, traumas, and toxins, which causes dis-ease in our bodies. This is your time. Stand up and talk about these things with your patients. Sit them down. Talk about nutrition. Talk about big pharma. Talk about the scary V word, and support their decision. See, what the medical profession has done, and I'm going to call them out, is if you don't follow the CDC recommendations for the vaccines, they would kick you out of the clinic. They would kick you out. And those of you who have stood up against the unbelievable amount of shots that the CDC now recommends, you know this, you experience this. There are a lot of medical doctors who would kick you out of their clinic and go against their Hippocratic oath to do no harm, right? Because you're supposed to support the patient. Your job as a doctor is to teach. That's what it means. It's to provide information and then support your patient's decision. You don't have to agree with it. You can hold them accountable, but you support your patient's decision, and you love on your patients, you care for your patients and their kids, to kick a child out of your medical clinic because they're not following the brainwashing that you got is hot garbage, and I'm calling you out. I don't give a shit if you like me or not, because it's wrong, okay? So I'm going to start highlighting these chiropractic warriors, and this is a call out to a majority of my profession, is stand up and get back to the roots of what the chiropractic is about, the thoughts of traumas and toxins. And for all the chiropractors who attacked me, you can kiss my ass. And you know who you are, and I know who you are. And I can't wait to see you at the convention sometime in the future. You all try to duck and hide away from me, but I will find you, and we will have a conversation about the attacks that you brought upon me for standing up against the lockdowns and mandates. Shame on you. Shame on you. As you can tell, I'm a little bit edgy about that particular subject. Chiropractors stand up. So the first one I'm going to highlight right now is Dr. Ben Tapper, who will be coming on this Friday at 12:30. This is him back in 2020 standing up. Enjoy.
My name is Dr. Tapper. I am in private practice in Omaha, Nebraska. I don't wear a mask. I see over 200 patients a week. I come in close proximity with every patient that I come across. Why haven't I contracted this so-called disease? Americans make up 5% of the world population, but yet we take in 65 to 70% of the world's pharmaceutical drugs. We are one of 2 countries that allows pharmaceutical advertisements on the television. But yet 80% of Americans are suffering with a chronic disease associated with poor lifestyle choices. 700,000 people will die of heart disease this year alone.
Doctor, please bring yourself in order.
600,000 people will die of cancer. 300,000 people will die of obesity this year. When is enough enough? If this is truly about health, then mandate healthy living, exercise, good food choices, chiropractic, outlaw tobacco and cigarettes, processed sugars. I believe it was Thomas Jefferson who stated, if people let the government decide what foods they eat and what medicines they take, their bodies will soon be in a sorry state as those souls who live under tyranny. You see, God made your body self-healing, self-regulating. If you give the body what it needs, it can be healthy. It is like the wilted plant that sits under the sun. An allopathic model to that is to shield the sun, to protect that plant against the sun, cut off its leaves, medicate or vaccinate that plant. But an epigenetic approach, a wellness approach, is to give that plant water, and it can be well. You see, your body is no different. We must eat well, move well, think well, and we can be well. In other words, your level of health is the genetic expression of your lifestyle choices. And I know full well that your body's ability to heal itself, to overcome disease and circumstances like corona, is far greater than anyone has ever permitted you to believe. Benjamin Rush, a signer of the Declaration of Independence, stated, unless we put medical freedom into the Constitution, a time will come when medicine will organize into an undercover dictatorship to restrict the art of healing to one class of men and deny equal privileges to others. That time is now. These masks have absolutely nothing to do with health, but everything to do with the complying with a false flag, tyrannical agenda. If we sacrifice our precious freedoms for temporary security, we will lose both. If you can't comprehend that statement, if you are blind to this agenda, then I am sorry. You have the eyesight of an eagle, but the vision of a clam.
Oh, I love it. There are many chiropractic warriors who stood up against this nonsense, and that's why I'm going to continue to highlight them as Robert Kennedy gets in there and makes America healthy again. Chiropractors have a decision to really fill a much-needed void in the healthcare industry or decide to stay silent. I refuse to stay silent, and so does my next chiropractor I'm going to highlight today. This video went viral when I shared it back in 2020 before it was taken down by Facebook. But Dr. Mike Hanifin, which is a personal, close friend, a colleague of mine that I've known for many years, he is a veteran. And how he ends this basically epic rant is glorious. So enjoy it. It's 10 minutes long, but it's worth the listen. Listen to my man, Dr. Mike Hanifin, just drop the mic on this woke ass, I think, city council. Enjoy.
Is it already on? Yeah. Good evening. I'm Dr. Michael Hanifin. I'm a decorated Air Force veteran, small business owner. I hold a bachelor's degree in science, a doctorate in chiropractic, and I'm currently a candidate for my doctorate in education. I oppose the extension of the order based on several factors. First and foremost, it's against the Constitution. It's an abhorrent act by our legislative body to violate that. Continuing on to the CDC website, which you guys love to quote, the goal of community mitigation on the CDC website is emphasize individual responsibility, not mandate it, emphasize it. Empower businesses, schools, and other settings to implement appropriate procedures. You need to prioritize the settings for critical infrastructure services, which you guys have had 8 months to work on, and you have come up with nothing as a plan to move forward. The emergency room doctor that spoke should have had a plan. If you don't have a plan for this, then you're going to run scared every single time and come to the conclusions that you guys have. It also says that you need to minimize the disruption to daily life to the extent possible to ensure the access to healthcare and other essential services. There is not access to healthcare. There's doctors that are doing telemedicine that should be in-person visits. As a chiropractor, I'm fortunate. All of my stuff has to be in person, and I love seeing my patients every day. But even my practice has suffered a 30% decline in patient visits because of the mandates and because of the fear-mongering that this assembly has done. My second point is the fact that the PCR test that's being done, as the previous caller admitted or spoke about, you cannot cycle this thing more than 30 times and have it be legitimate. The PCR test was never designed to diagnose a disease to let you know you're ill or that you're contagious. This is the research. Your doctors that are advising you know this. When the PCR test was designed, it was to let you know something was there. They can test for anything. It just signifies that it's there, not that you're sick. With my remaining time, I went through all 9 studies on the Department of Health's website. Your own website, okay? All 9 of them. Not a single one was definitive that masks work, because they don't. You cannot hide from a virus. It's out there. It's a MAHA. This one used a model. You had a futuristic one on there too from 2021. That was interesting. So, children under the age of 10, not testing positive, not an issue. Schools should be open for at least them. That's my testimony. I oppose this mandate.
Thank you. I have a question for you, sir, from Ms. Allard.
Hello. Thank you for your service. Much appreciated. Can I get your name again, please?
Dr. Hannafin.
Thank you, Dr. Hannafin. So I have been taking some notes tonight, and I wanted to ask you a couple questions if you can answer. So they say there's a large number of asymptomatic carriers. There are also a large number of people that will continue to test positive after they are no longer contagious. Have you heard that before?
Yes, ma'am.
And why did you hear that?
Through the research that I did, the additional research that I did, when we look at asymptomatic carriers, the study that I reviewed was from both Italy and from Iceland. They were the largest cohort studies that have been performed to date in regards to COVID. And they demonstrated that somewhere between 46 and 87% of those tested will be asymptomatic. So by that means, the spread of the virus is going to happen, and many, many people are not going to show signs of symptoms. The benefit of that is that they're not impacted by those symptoms. They're just positive. But the PCR test will also show positive for a coronavirus. There is a human coronavirus. That's going to show up on a positive test. That's the common cold, by the way.
So Dr. Hannaford, no matter what we do, and if people keep testing over and over and over, if they're positive, the likelihood of them not being contagious, but always positive, it's there. That's a fact,
It's
a
very
medical
high.
fact.
It's
Okay.
absolute fact.
So I'm going to ask you a couple other questions, and just a simple yes or no. Did you know that Alaska is 49th in the country for COVID deaths? per million. It's pretty good.
Yeah.
Also, we're 29th for the total case per million, which means we're either the death rate is low because of the demographics, that we're younger and we're more fit, or we have a less virulent strand. Can you explain that, what that means about the strand, so I can understand it a little better?
The flu virus is a great example. Some years the flu is much more virulent, and it has a lot to do actually more with stress levels of the individuals than it does about the actual strand itself. If we continue having these lockdowns and these fear-mongering and these misrepresentations of the actual science, then you weaken people's immune system. You don't allow them to exercise. We have not seen anybody from this body or from the doctors that are advising you advise on supplementation that could be beneficial, like vitamin D, vitamin C, and zinc, all been proven to help not cure it, not avoid it, but at least boost the immune system enough that you have a better chance of survival, even though it's 99.95% survivable.
And then my last question to you is, we all have our mask. Do you talk to your friends and other people that say every single time they have their mask, they absolutely wash it, or they put a new one on, or they don't touch it throughout the day and leave it on their face non-stop?
Okay, that was my biggest thing in the very beginning of this, is the fact that although we'd love to think that everybody knows how to wash their hands, we have to give them instructions, but these masks are absolutely hanging in everybody's car for days. And they're picking up everything coming in and out of that car. So the chance of actually exposing a patient to something more deadly is higher by wearing masks that people cannot stand on their face and touch and cross-contaminate. And then in California, they said, take your mask down, take a bite of food, and put it back on. What do you think they're doing? They're literally cross-contaminating with that mask every single time you touch it. Now, I'm actually really impressed. Very many of you haven't touched your mask tonight. I can't stand it. You've done a great job, too, until now.
Thank you. Moving on, I have Ms. LaFrance.
Thank you, Mr. Chair. Thank you for coming and for testifying tonight. I'm sorry, I missed your credentials. You are a doctor
Of chiropractic.
chiropractor?
Yes, ma'am.
And then you are working on a PhD
I have it in education.
in education. Okay,
Yes, ma'am.
congratulations, thanks. I wanted to be clear, I understood what medical credentials you have. Thank you.
Thank you. Mr. Constant?
Yeah, thank you. I've been having a little hard time hearing that testimony. I'm trying to understand how much virology this speaker studied in medical school. Thank you.
I'm sorry. Could you repeat that one more time, Mr. Constant?
Oh, I heard him just fine. And he responded to my email, the first testimony that I gave, as you, Ms. LaFrance, so rudely put, my medical credentials. Just because I'm not a medical doctor does not mean that I don't have an education in, Mr. Constant, virology, immunology, histology, biology, biochemistry. These are all standard classes that I take, and I graduate with over 300 credit hours more than the average MD in this town. So don't question me on my education. It's all included, including virology.
Thank you. Again, I'm going to ask folks to not... So I'm going to go ahead and just give a final warning to you, Mrs. Hill, and to you, Mrs. Wilson. Otherwise, I'm going to ask folks to not be hooting and hollering, please, because that's not helpful to our process. Ms. Allard?
Thank you. So my last thing is that, would it surprise you to probably know that you have more medical experience than anybody else in this room tonight?
I certainly do.
Thank you. And the other last question to you is, do you know of other doctors and nurses, as I do, that have refused to come forward and testify because they're worried about losing their licenses or the backlash from their superiors?
We have had several things put out by our board for the chiropractic community that have encouraged us not to talk about vitamins, not talk about things that will boost your immune system for fear of backlash. I put out a video, I refuse to delete it. I served my country to defend your right to do dumb things.
Thank you.
Thank you. Thank you for your testimony.
Oh man, that is the most epic mic drop moment. Served my country for your right to do dumb things. Dr. Mike Hannafin, my brother from another mother. He is spot on, and it gives me the chills to watch those videos again. And again, this is all from 2020. These gentlemen, and I know there's a lot of other chiropractors out there who did the same, stood up against this and took the heat. Man, oh goodness gracious, did we take the heat? You know, all of our practices were suffering when we stood up. You know, my practice, we lost like 40 to 50% of our patients because they were huge Whitmer supporters, and me standing up against her, they didn't like that. And I don't regret anything. And that's why I will never forget. Now, look, the after action report on COVID, it confirmed what all of us already knew, right? That social distancing and mask, especially mask mandates, were never backed by solid science. And here's what people who fell for it want to do. They just want to forget. They want to forget the ones who basically blindly follow. They judged and they attacked us. They attacked us online. They tried to destroy our clinics, to all of us who stood firm in the truth. So my question is, how do you feel now, knowing that everything that you attacked us for, everything that you tried to silence us for, it was all proven to be nothing? See, you champion lockdowns. You champion lockdowns that destroyed businesses. You shattered families, crushed mental health, not only into the adults in our children, set our children's education back, and you laughed and ridiculed all of us who refused to comply, calling us reckless. How many times did we hear that word, reckless? Now that the truth is out, I can forgive your ignorance. I can forgive that. But I will never, ever forget how you allowed your fear and your compliance devastate so many lives. Please wake up. Please unplug. Please question. And that's what I will continue to do, is question everything that doesn't feel right into my gut, into my soul. And I will always, always stand up for not only all of you, but more importantly, the ones who can't stand up for themselves. And the last video that I'll show today will be the time when I stood up at my children's school board meeting over the mandates.
Garrett Soldano.
Number one, just to reiterate, you guys are all in a tough position, and I thank you for listening us out. And I just want to tell everybody here on both sides of this equation, you all inspire me. All of your stories, standing up, that's what this is about. It's about we the people. I want to make that known right now, okay? But here's what I'm going to talk about tonight, is number one, you do not mask up healthy children, ever. You do not mask up healthy adults, ever. Okay, and I'm going to remind everybody, it's in the medical profession. This comes from your own dictionary. Dorland's Medical Dictionary states that true health is a state of optimal physical, mental, and social well-being, and not merely the absence of disease and infirmities. That includes this virus. And I appreciate all the medical professionals who came down here and they witnessed the horrors of COVID, because it does in fact exist, and it's a nasty virus. However, all their solutions and all I heard was to vaccinate and mask up here on out to eternity. No personal accountability. Where's the talk about nutrition? Where's the talking about strengthening your children's immune system with supplementation, allowing your body to be an environment of greatness the way God designed us? If God wanted us to have a mask on our face, he would have made us one. I hear a lot with the vaccination. Well, let's look at the results, folks. 99.99% survival rate. But you know the people who are not vaccinated, the survival rate of this virus is 99.98. So for a 0.01%, we're even talking about possibly mandating this in our country. And your argument is saying, hey, we're trying to protect the teachers, which I get. But the risk of a child contracting this virus, giving it to the teacher, and the teacher actually dying is so astronomically small, I don't think there hasn't even been one case. And for the physician that came up here and said, we don't get to have a personal choice with regarding health, that's garbage. We live in America. We have freedoms. We always have a choice. We have a choice as parents. We have a choice as Americans on how we want our kids to be raised. And just like that gentleman said, it is your job to give our kids an experience, a positive experience, not bring down the hammer. Earlier this year, there was a study done that compared Florida counties, and the counties that had mask mandates versus the counties that did not have mask mandates. The counties with mask mandates in place did worse. The counties that did not have a mask mandate actually did better, and they also included population density in the study. Then they went further and started comparing other states, and they found the states with mask mandates had 27 cases per 100,000. The states without the mask mandate had 17 cases per 100,000. They concluded that mask mandates do little to stop or even slightly curb the spread of COVID-19. 2 days ago, Fauci came out and was on record as saying, hopefully, and I repeat, hopefully making young kids wear masks won't have a long-lasting negative impact. And I know there are 2 medical doctors on this board, and it is your Hippocratic oath to do no harm. And Fauci comes out and he said he hopes that there's no long-lasting side effects basically to mask wearing. Unbelievable where we're at. It's time to lower the fear. It's time to look at the true science and data that's out there, not the political science and polling data that people continue to run with. It is up to you to make the choice on what you want to do, but I'm telling you right now, and a lot of parents agree with me,
Sir, if you
I
could sum
will
up
be
in 30
pulling my
seconds.
child from this school if you guys mandate anything, because it's up to the parent. Thank you. So unfortunately, they decided to mandate masks. And I'm a man of my word. I immediately pulled my children and we homeschooled for the next, I think, 1.5 to 2 years. That's what it takes. Ordinary people doing extraordinary things. See, you can't sit in the shadows, because when the majority of us stand up and say no, they can't do anything. And that's what they're so afraid of. The corporate media, the mainstream media, basically the political arm of the Democrat Party is your enemy. They push out a narrative, and look what they were able to do. They fear-mongered, unfortunately, the majority of our society to just blindly hand over their constitutional freedoms, their sacred values. How many of your churches shut down? Where was the faith, right? Your citizens' rights were stomped on. But there were a few of us. There were a few of us that stood up against this tyranny. And I will continue to highlight those who did, who stood their ground, even when there was an ocean of opposition pushing back against them. These folks are the true heroes that stood for you and stood for your children when others wouldn't, when so-called professionals would not. So I'm excited to have Dr. Ben Tapper on. I'm going to reach out to Dr. Mike Hannafin, my good friend, and see if he'd be willing to come on, because that was definitely one of my favorite stand-up videos of all time. He served his country for your right to do dumb things. I mean, that was this, that should be a t-shirt, Mike, that's for sure. But I also want to end too, our merch store of the grassrootsarmy.com. The link is in the description. I'm going to share that right now. We have our merch up and going strong. I want to bring it up. Let's see if we can do it. There it is. There's the grassrootsarmy.com. The link is in. And this is our current merch that we have right now. Long sleeves and hoodies. Obviously, Eddie Penny's Unafraid line. The guy's phenomenal. If you guys ever want to see and hear a wonderful, wonderful interview that he did with the Sean Ryan podcast, it's on there. It's almost 4 hours, and it's worth every single minute of the interview. He allowed us to use the Unafraid, which I love and what it stands for, obviously the Grassroots Army. And I'm trying to push this line to be more positive with that intent. That's why we got the Fearless up on there. And obviously the Mighty Warrior. This is one of my favorite ones. Comes in a lot of different colors for all of you. But that is your opportunity to go there and order something. And if you order this week, you'll have it before Christmas. That's what my team at AZ Business has told me, that they can get it out before Christmas. So if you get your orders in this week, they will be shipped out by Christmas time. What great presents. And I will continue to produce merch and other things for you to be proud of, to understand and know that you are a part of something bigger than self. It allows us to stay afloat too. The Grassroots Army, it does take money to do these platforms, because I can't monetize my content, because the stuff that I monetize promotes hate, they say. Spreads misinformation, they say. So unfortunately, my hundreds of thousands of followers, where other social media influencers can monetize and pay the bills that way, we cannot monetize. They do not like my content. Weird. So I do need your guys' help and support to keep these things up, because it does take a lot of money to produce these things, to put them out and everything else. And you can support us by going to thegrassrootsarmy.com and buy yourself a sweatshirt or a family member. That does help. Every single cup of coffee that you support by buying for the Grassroots Army does keep us afloat, for us allow us to produce content. So go there, get your orders in, and then you will have it before Christmas, as long as you get your order in by the end of the week. Okay, so we have like a couple more days. Let's get them in. I think Monday will probably be the last day that I'll say that. But you do have some time. So go on there, thegrassrootsarmy.com, and get yourself and your family members an awesome, positive message. A shirt, a sweatshirt, a hoodie. Also, you have to get on X. My goodness gracious, Dr. Ben Tapper actually has over 100,000 followers over there. I do not know how long Facebook will allow us to talk about these things. So if you want free speech, I know a lot of you guys are on Telegram and everything else. It's kind of like just a small echo chamber. X is a very, very large platform where you can get a lot of great information. So go on X. You can follow us at the Grassroots Army, Grassroots Army, not the Grassroots Army. And then you will get up-to-date, accurate, truthful information. If they take me down, we will always share that stuff over there on X, as long as Elon allows it to continue to be free speech. Okay, that's why this Friday, when I bring Dr. Ben Tapper on, I will disconnect my YouTube channel. Okay, because YouTube took me down over a year ago with 250,000 subscribers, 239,000 subscribers I had. They took me down in an instant because I was exposing the border, and they said it was hateful. Unbelievable. But my YouTube channel is growing. It's at 6,000 subscribers now. But there's still people on YouTube. That's why I continue to grow these platforms. We're on TikTok. I'm on my third TikTok. They've taken me down. Same thing for exposing the school boards and the radical religion, the LGBTQ plus religion that has been force-fed down our kids' throats. I continue to highlight that, but TikTok always deplatforms me for just sharing school board meetings of parents standing up. Just like when I shared the 2 videos that I just showed you today, took me down for misinformation because we were standing up against the mandates, the lockdowns, the mask, talking and questioning the vaccine. Now it's all been proven. Guess what? To be true. We're running out of conspiracy theories, folks. That's for sure. So tune in this 12:30 on Friday, or this Friday at 12:30 to Dr. Ben Tapper as we talk about MAHA, Make America Healthy Again, talk about Big Pharma. The guy is a wealth of knowledge. I'm very excited to have him on, very honored to have him on. Now I'm going to reach out to my man, Dr. Mike Hannafin, to see if he'd like to come on soon and talk about his journey and what he was doing at the time of COVID. Have a great day, everyone. God bless you. God bless the state of Michigan, of course, and always God bless these United States. Till next time. Goodbye.